Hello there everyone, and welcome to another video with Hypnotherapy Training International. And today I would like to talk about the use of hypnosis in surgery and medical settings. In recent times we've been hearing in I believe the Telegraph newspaper that about a study that used virtual reality and hypnosis to help people through operations. So Dr. John Butler himself has been through an operation where he had no anesthetics or no painkillers, and he also helped several patients to go through an operation and medical procedures with the use of hypnosis and the power of hypnosis. So John, if you can tell us, how does it feel and whether it's suitable for everyone, this kind of alternative sedation, and also your experience, and a little bit if you can touch as well about Jack Gibson, because when we talk about these things, that's a close friend of yours and from a previous century, but still, if you can tell us a little bit about the kind of things it involves, and if we as hypnotherapists can be trained to do that, and where we can be trained. I know you have a specific course dedicated to that particular topic as well, so maybe you can touch on that.
Sure. Well, firstly, it's very gratifying to see this work being done now after nearly 200 years of hypnosis being on the sidelines of medicine, on the periphery. It's now being brought in as a serious aid for surgery. As you know, for many elderly or weak people, the anesthetic poses a great risk to their survival, and even if they do get through operations, maybe they have post-operative complications, depressed immune function and other effects of shock on the body, so they may have pneumonia or other symptoms and infection and so on. So those are complications that can be reduced, even eliminated with hypnosis. And
if I may say, I had a few operations, unfortunately, due to my various conditions, and it's an awful feeling to be put down, and it's awful being brought back up, and you're always nauseous. For me, lasts for days. The taste of metal and glue. If this can be avoided, then it can be, as I now know. But it's such a special thing. Sorry, if I just had to put that, because, and for me as well, the brain fogs you get after that. I don't know how to explain it exactly. Like, my brain is never sharp. Every time I go in, I feel it's done something to me. I know it's necessary. For those who don't know about medical hypnotherapy and medical hypnosis, but I now know, so I'm very confident in my future. If hopefully I don't need, but if I do, I know where to go.
Well, you're learning about the classes we teach, and you can learn the self-hypnosis. We make that a very big part of our training. Every hypnotist learns self-hypnosis.
And just to mention, a few months ago I had some dental treatment.
Yes.
After not looking after my teeth as good as I should, and I went to one of your students, Dr. Nigel Aga, and the head of the dentist clinic there, after the first one, the nurse went to call him, that they treated me, and they had a few fillings were full on. It was the quickest time I've ever been to a dentist, the best ones, because what I like that he can test with me straight away how my biting feels, and I think it was half an hour, 40 minutes, and I went back home, got on with my day. I didn't have any that mouth jaw dropping, so that was great.
Yeah, and you did that all on your own. So, and this is one of the things people learn with hypnotherapy. You use their own mind-body mechanisms, their own resources to control your body in a healthy way, in a safe way. Now, for helping your blood pressure, helping your heart if you have heart issues, in conjunction with medicine. Now, in this study you mentioned the virtual reality, so using the goggles, using the computer simulation and so on, they were able to relax and dissociate from the environment. You know, in their mind they're off doing something else, swimming with fishes or whatever it might be. And so that induces a trance, opens the subconscious. The power of the imagination is now being applied. And you can combine that with suggestions for comfort, safety, and even for particular kinds of numbness if you had specific need to focus on numbing an area of the body. And this anesthesia is very powerful. Now, not everybody responds as quick or as easy. In an emergency, non-elective surgery, of course, there's a great need to get on with the surgery. And you mentioned Jack Gibson. He would operate on them coming in with very severe injuries, coming out of road traffic accidents and they lost an arm or a major part of an arm, and then he would be doing the surgery with hypnosis, no anesthetic, no sedative. So it's been done for very severe operations. You mentioned the hernia operation I had that was there, and I've done it for several people with hernia operations with no anesthetic, and no sedative. However, it can be combined with a local anesthetic, and that way the client needs a lot less anesthesia, chemical anesthesia, and has then not have to deal with any of the side effects of, say, the general anesthetic, which can lead to this nasty feelings for a lot of people, and maybe your bowel is not working well for a while, and other complications. Some people, elderly people, the anesthetic, as I said, can be very dangerous. Some are anesthetic averse, a small percentage, and we have to be able to help those people. So I've used it in those kind of settings, and it is a great, great benefit for medicine. Now, chemical anesthetics have come a long way, and they are wonderful, but they do have their limitations too. Everything in medicine has its strengths and limitations. Many drugs you give people are very helpful to them, but there are side effects. And we know that hypnosis can reduce the side effects of many drugs. This is only in the early stages of being researched. So you get better results from the drug and less negative effects, so-called side effects. So we need to be bringing this into medicine, and frankly, it's something of a clinical disgrace that we're not using it more readily, based on nothing more than a bit of ignorance and unscientific prejudice. We know hypnosis is of great benefit in surgery in reducing stress, preoperative anxiety, giving a whole different quality of experience for the client in surgery, even if they're having general anesthetic. Or, instead of general, moving to local. So that's much less of a demand on their body. And in some cases, you don't need any anesthetic. Now, so virtual reality is great. And in the past, we've used CDs when I wasn't there. I mean, many times I was there for the surgery. But technology has its place. And of course, ultimately, that's a good way to standardize it for studies. And you have the benefit, you don't have to have a therapist there. But there'll be situations where it's quite appropriate and necessary to have a therapist there even. And you can train the anaesthetist to do the job. Now, let's look at Jack Gibson. He was a surgeon and the hypnotist. He kept telling him to relax more and more while he did major surgery, including amputations.
And working both in field situation in South Africa, I believe.
Out in the field, out in the bush. Yes, he worked in Britain with war wounds. He was a very accomplished, gifted surgeon. And he did many thousands of surgeries with no anesthetic or very, very little anesthetic. And so, all in all, there are many benefits, as well as the reduction in the use of anesthetic for increased healing and recovery and quality of experience generally. There's so many ways we can boost a person's systems to cope. As the opposite effect is having when they're stressed, they're depressing their immune system. Yep. And that's not good. We want to be able to avoid that and make surgery less fearful, less demanding on the body. So we teach courses where we teach anaesthetists and surgeons specifically. Those courses are just for that group of people in medicine who are working in the theatre. Now, of course, we've taught many dentists. You mentioned Nigel. We've taught many dentists and physicians who work in general practice the use of hypnosis for chronic pain. Yeah. Some clients respond very quickly to suggestions for pain control. Others struggle much more. And sometimes you've got to go deeper into the issues. Again, regression therapy with analysis. And so we teach that in the classes. However, many people, when the demand is there, when they have to have the surgery, they stop messing about and worrying about it and doubting it and so on. They give up the negative suggestions. In other words, they accept the suggestion, I'm getting numb, I don't feel anything there, and they sail through the surgery at that point. So we can do a lot with hypnosis for pain control and in medicine generally. And it's something I'm very passionate about. I've been teaching it for best part of 30 years. I wrote and taught the first official training course in hypnotherapy in the NHS back in 1990. And over the years, we've taught many doctors, dentists, surgeons, healthcare practitioners of all kinds to use hypnosis within the conventional fields of medicine and dentistry with great value to them. They become very enthusiastic. And I think the public are now getting to understand that hypnosis is nothing like those old-fashioned negative views of having your mind taken over, and so on. So it's a serious, hugely beneficial clinical practice, which medicine has always accepted. Back in the 1890s, British Medical Association said it should be part of the medical curriculum. In the 1950s, the American Medical Association and the British Medical Association again reaffirmed that position, but it's never come into the mainstream medicine. Back in 1950s, Dave Ellman, who taught so many doctors, he said it needs to be a 3-year specialist training in medicine. Along with learning it during your basic medical degree, you need to learn more. And he said it's a 3-year course. You'll notice he wasn't saying it's a one-trick pony, a one-shot therapy, because some of those problems people bring to you with psychosomatic illness, including chronic pain, have very complex emotional roots to them, difficulties there, and you need to know how to be able to deal with them. So that's called analytical hypnotherapy, one of the things that we teach. Now anybody will be able to be helped to calm themselves down for surgery, reducing sedative, eliminating sedative even, if that's desirable. But all in all, bringing it in to be an adjunct to medical treatment and a great help to the doctor, the medical staff and the patient. I mean, it's a win-win for everybody.
It is incredible. So if you are watching this and you're interested to learn more about medical hypnotherapy, there's a course coming up in November, December. Get in touch with us and we'll put you through to John so you can learn how to join and take that course. As John mentioned, it's highly recommended to surgeons and all doctors, to dentists, to nurses, and also to hypnotherapists that have clients that have to go through medical procedures. That could greatly help and improve your practice and what you offer and support your client further. So John, thank you so much once again.
Thank you, Ilan. Thank you also for listening and watching.
Thank you.